Welcome to the Weigh In Podcast, your prescription for a healthier life, where wellness is more than just a number on a scale. We'll dive deep into not just weight loss, but the medical, emotional, and lifestyle aspects of well-being.
In each episode, we'll weigh in on hot topics ranging from diet myths and exercise trends to mental health and chronic disease management, providing you with the evidence-based advice to guide your health decisions. Remember, it's not just about the weight on the scale, but about creating a healthier, more balanced you. Hey, Katie, how's it going?
Pretty good. How are you?
I'm doing good. Have you heard anything in the news about anything juicy from weight loss?
Well, there's actually been a plethora of juice, I would say. One piece of news that dropped recently was about this new drug that's still in its early stages. This is a GLP-1. It's called CT996. It looks like it's made by the pharmaceutical giant Roche. I always mispronounce the name, guys. So I'm not quite sure if I got that right. Anyway, initial studies of this drug have shown that it can cause significant weight loss. So much so that Swiss shares for Mounjaro and for Ozempic actually dropped a little smidge. So very, very interesting. That being said, don't get too excited because it's going to take a little bit for this drug to come out. I think probably at least a couple years. So this is not a drug that's imminently going to come out. One of the perks of this drug, beyond the fact that it also offers significant weight loss, is that it is an oral medication. That being said, Novo Nordisk definitely still has some legs to stand on with their oral semaglutide that is now out and available and seems to have been somewhat well received. So definitely it should be interesting to kind of see how the competition works out with all of this. But I think something that will be interesting to see is, will there be a shortage, right? Will this company actually have this drug in stock and available for patients to access? Because so far it seems like all of these companies with all these amazing drugs can't keep the drug in stock. So hopefully we'll continue to get more information on this. But yeah.
Is this company claiming to be better than Ozempic or Mounjaro?
So I would say that the verdict appears to still be out on that. However, in studies that were done initially, at least, for 4 weeks, patients lost an average of 6.1% of their starting body weight compared to placebo, which is pretty impressive. So we're talking pretty significant weight loss. I think something that would need to be compared if we're going to try to compare this drug with others is, I think a comparison to oral semaglutide would be interesting, right? It's a little tricky to compare this drug to like injectables, so it's kind of like comparing apples to oranges. But it would be interesting to see, like, is this drug going to be more effective than oral semaglutide? Because if so, that's pretty impressive. And those people that don't like to self-inject would be probably like super successful if they were able to get a drug that was A, well tolerated, right? So it doesn't cause significant side effects, and B, equally as effective as an injectable. That's like everybody's fantasy drug, right? So it should be interesting to kind of see what further studies they're able to do. And in general, I would love to see some more studies come out with more direct comparisons between all of these drugs, right? A lot, we're saying that peptide is more effective than semaglutide, and we definitely see it in practice. And there has definitely been some research and some common sense, right? Like basic science to support this, but it would be nice to see more and more studies come out that really can show us that like X is more effective than Y.
Yeah, interesting you say that about the oral semaglutide too, because I feel like some patients ask for it, but from at least what I've gathered from other colleagues is that it doesn't seem to be as effective as the injectables, because the strongest dose of the oral form, it's like doesn't compare to the strongest form of the strongest dose of semaglutide going to the 2.4 milligrams. So yeah,
not to mention the GI effects that I've heard about with the orals. You can only imagine. I mean, I can only imagine, and I've never taken the drug myself, and I don't have any patients right now that are on oral semaglutide. So this is sort of like just what I've heard is complaints of a lot of GI distress while taking the oral version of the drug. Again, I haven't prescribed the medication to any of the clients in my practice, so I can't speak to it, but
Yeah, and I feel like if there were a study to be done on all the weight loss meds out there, that'd be so interesting because at least from it kind of depends on what your goals are. Like typically if it's someone who is trying to lose a certain amount of weight within a certain time frame and they want it fast, then I would more so suggest like phentermine or those oral stimulants versus the GLP-1s or an oral version of that because it's a lot more of a slower weight loss medication. So that's kind of a reality that I have to like place for people to get their expectations straight. So I feel like, yeah, I would probably go with more of the oral version if, again, like you said, they're scared of the injectables, but they don't want to do stimulant because stimulant has a lot of side effects associated with it. So if nausea is kind of more of a like lesser of the two evils versus like jitteriness and like heart palpitations, insomnia, then would probably side with that. Um, I've also used Contrave as well, which is a good
Mm-hmm.
medication too.
I think, yeah,
So
I think it's kind of funny how like none of us really talk very much about the other oral drugs that are out there. Yes, there are these oral stimulants, but I think when we think of oral meds, a lot of people just automatically assume that it's just phentermine that's out there, and that's not the case at all. There's so many other great oral weight loss drugs if you don't want to do the injectables. And a lot of them, yes, have that stimulant side effect profile. But for a lot of these other drugs, especially the older ones, as you know, I'm a huge fan of meds like diethylpropion. A lot of patients don't complain of very many side effects at all, and it can help them kind of relatively quickly get that like 10 or 15 pounds off that they're trying to get off. So all the more reason to really see a licensed medical provider about your weight loss because these GLP-1s are fantastic drugs, but you might not need them necessarily, right? If you're just trying to get X amount of weight off, right? Like maybe your wedding's coming up in 3 months and you just want to get whatever off. And B, if they're not accessible to you, you should know that there are other alternatives that might be more affordable. So something to think about.
yeah, well, I'm excited to hear more about this new drug in the
Mm-hmm.
future. So I'll keep, my eyes peeled. Yeah, as far as my news, so there's been a couple of articles out within the past couple of days or so, or past week, just stating that like only 1 in 4 people still take Ozempic and Wegovy for weight loss 2 years later. So it seems like people stopped taking them after some time. It didn't say as to why they did it, but of course, apparently these people were diagnosed with obesity. And so I'm assuming they reached their goal weight and was like, okay, I'm good. On top of that, there's other issues like maybe insurance stopped covering it.
Sure.
Because I know that at the beginning they'll give it to you, and then it's just harder to get after that. You need to get a new prior authorization, or if you change dosages, there's, I don't know, always some weird stipulations with insurance and stuff. Um, and on top of that, yeah, if they end up needing to pay for out of pocket, very expensive. So they probably just
Very
ended up stop
expensive.
taking it. Um, and then again, like for some other people, they just don't see the need to take it anymore once they've, reached their goal weight. Again, this is kind of what we're assuming. It doesn't really state reasons as to why people stop taking it in the article, but that's just what they're trying to assume. Yeah, and I'm sure side effects also play an issue here. Like nausea is not very fun to take, and if you always feel nauseous from taking the meds, like why subject yourself to that? You're just like, nope, I'm gonna take something else, or I'm just gonna like find other ways to lose weight. I just can't deal with this nausea. Very debilitating for some people. I've had some people tell me like, yeah, I had to call out of work. The next 2 days, I was just like,
Mm.
so nauseous, vomiting. So unfortunately, they just can't tolerate it. But yeah, that's why it's so important to start off at a low dose and then increase because yeah, it's a new medication. It can cause these side effects. We want to make sure that you're okay. So
I wonder if, sort of, from this piece of news, if something that's playing a factor is sort of these early thoughts that this medication, sort of the disinterest that people kind of get in things, right, when they're on this drug sometimes, and these concerns about sort of maybe this drug causing a little bit of depression, if maybe that's sort of also impacting people's willingness to be on the medication long term. I don't know.
yeah, no, that's definitely a thought. So like, yeah, I think a few episodes back kind of had mentioned how um, it makes you lose interest in things because in the brain center you don't have that dopamine effect like after you eat food, because when you're on Ozempic or any of these weight loss drugs, like it just kind of, I guess, numbs you to it, and you don't really get that enjoyment anymore. You don't get that reward system. So yeah, that makes sense. And if it starts to affect
Yes,
like your,
anhedonia is the word that I'm thinking of.
yeah,
I'm
there
like,
you go.
there's a word for this. We're not being interested in things. Yes.
Right. Yes. Um, so yeah, if it's just not a sensation that you like, totally it
Right.
makes
And that like
sense.
it's worth it when you're trying to get the weight off, right? But like perhaps once you're at that goal weight, if you're like, oh, I don't want feeling right. Think about like the people who have ADHD and maybe are prescribed Adderall, but only take it as needed because they don't love the way it makes them feel, right? But when they're taking that test or doing that studying, they want it for at that time. Perhaps for patients that are sort of like recovering from obesity, this is a similar sort of type of thought. I have no idea. And there's so many other more likely reasons, right? That those being A, side effects, B, access to the medication, right? Like insurance coverage, cost, not to mention, once again, the medication actually being in stock.
Yeah. Right.
That could have a huge impact as well. And that's stressful to keep up with, right? So,
Right. And of course, so this only mentions brand name drugs. I wonder, like, are they also seeking out compounded or the compounded version? Are they going to like weight loss providers just specifically and just getting meds that way, especially if they lost access through insurance? They're like, well, I can't afford the 1,500 a month. I'm just going to go to another provider. I have had some clients that have been on it for a year. I mean, my practice hasn't been open for 2 years, so I can't like say they've been on it forever. But a lot of the times, even when they've reached maintenance, they really like just having it on hand, and they kind of think of other things that are going on in the future, like if they have a wedding to go to or if they have a vacation later on, they're like, you know what, I kind of just want to stay on it. I don't want to lose my, I don't want to lose track. I want to like keep on it. I don't want to regain the weight. So
I mean, the recommendations more and more are steering in the direction of that, this is a medication to be on chronically if you're obese,
yes,
and to be on long term. I mean, again, like we just said, it's not always realistic. It's expensive, and some people don't want to inject themselves once a week. But I don't necessarily think it's a bad thing to be on the medication long term if you need it.
yeah, and it's similar to people that are on HRT, hormone replacement therapy. I mean, they probably would need to be on it for life because it's just your hormones are low, and the only way you could replace it is through like taking hormones, right? So yeah, same with these medications for the GLP-1s. Again, there have not been any studies that have found any long-term issues with taking it, for a long amount of time. So that's the cool thing about it. It's a very natural medication. I think people just have that mindset of like, well, it's medication. I don't want to get on medication. And it's probably one of the safest medications you can get on as far as weight loss. Like again, versus the stimulants, this just has a better profile as far as who we can prescribe it to. You could essentially prescribe it to anyone, even if they have like kidney issues. It's actually renal protective. It's a great medication for pretty much anyone that I could think of, aside from like if you're going to do like pediatrics, no one under 12. But
no, you're absolutely right. It has, it's so cool now as a weight loss provider. There used to be a time when, I would look at somebody's medication list and be like, oh man, you're on so many drugs that interact with these stimulants. I can't put you on anything else. Oh my, like you're already on like all these other drugs. I can't put you on it. I'm so sorry. Let's do this other thing instead, but this is your only option. And now I can be like, actually, we have semaglutide. We have tirzepatide. It's not going to interact with your. So it's really, really cool. To be able to offer that, if you were somebody who had a history of cardiac disease, it used to be you didn't have that many options as far as weight loss medications. There were some, but there really weren't that many. And it was kind of like, this is so crazy because there's so many, you need this more than anybody, but we can't, I don't have much, but now I do, which is so cool. So as someone that was doing weight loss prior to opening a clinic, I can just tell you that like, it's really cool to have all of these options now.
Yeah, I mean, I think one other thing that we've talked about too, which is like the birth control. If you're on like oral birth control, you kind of want to be a little bit more cautious, because we've found out like, could increase your chances of pregnancy because it interacts with the digestion, and that's where the oral meds go. It goes through the GI system. And so if it's affecting, if the GLP-1s are affecting your digestion of oral birth control, then that can mess up with things. But yeah, again, otherwise pretty safe. All the medications that I've run through, I have some patients asking me like, can I take with these vitamins or whatever? Essentially, yeah, I can go with anything. Aside from like if you're diabetic and you're like taking something similar like Saxenda or any kind of GLP-1 medication, then no. But yeah.
Yes, and all of the other sort of like contraindications that your medical providers have already talked to you about, such as if you have a family history of medullary thyroid cancer, et cetera. But I agree with Serena that it's very, very overall very minimal interactions with other drugs, which is why it's such a cool drug to be able to prescribe.
Yeah, I remember like being so scared when I like first started this. I'm like, oh, I don't know, I'm not really familiar. And now everyone's just, they drop Ozempic like no, like nothing. Like they already know what it is. They already know these medications. Like, it's just something that is just normal now. So
it is something that's just normal. And I used to be so scared too. I would call Emily, who's going to be on our podcast, and because she was working in primary care at the time, and I'd be like, Emily, like, can I do this? And she'd be like, oh my God, yeah, because primary care providers, this whole thing is light work. They've been doing this for years. They've been prescribing this for years, whether it was for diabetes or whether it was off-label for weight loss. This is like nothing. She'd be like, yeah, why wouldn't you be able to increase their dose to this or whatever? But initially there was sort of this like fear even on my end. I was like, oh,
right,
or I would overdo things. I would overdo the frequency of labs. And like I said, for PCPs, this is like light work.
It's a cakewalk. Yeah.
Yeah.
Or like, oh, I prescribe it like every other day. No big deal.
Yep. Or like when the news suddenly gives information about like some like known side effect. This poor drug is like the Britney. I always say it's like the Britney Spears of of the world right now, because it's like being like a pop star, right? Like everyone has like, they're getting good press, it gets bad press. Things that are already known sometimes get framed as being like brand new hot news when it's like that's been a known side effect. So I'm sure as a PCP, it's like crazy to see like headlines that say like, new news, semaglutide causes nausea, or like whatever. You know what I mean? We know the news has been totally different than that, but I'm sure like as a PCP, you're like, yeah, this is how it's been since the drug first came out.
Yeah. Yeah, it's really not, novel medication. Like it's been out for a few years or probably longer than that, but like out more like to the public. And now everyone kind of just knows about it. But yeah, every other day, I'm sure there's always articles that come out. And overall, again, safe medication, safe for you to take long term, and again, also something you get off of. It's not something you have to stay on forever. So just kind of depends between you and your provider what you want to do, what your goals are, what your medical history is.
Yes. As an aside, Zarina's clinic is located in California. She's available for virtual or in-person visits. I think you're also getting licensed in some other states for telemedicine, right?
Yeah, currently Nevada and I honestly forget the others. I have not been working on it very diligently.
You guys, let's sign a petition for Zarina to open a clinic.
Oh, Oregon.
I'm less excited about Oregon, although if you're in Oregon, by all means, book an appointment with her. But I'm very excited for if Zarina would please make a brick and mortar in Vegas, in Nevada, right? And then also
Vegas,
yes, and then also get like a penthouse in Vegas that I can have full access to. You know what I'm saying? I'll go there. I'll check on your patients, make sure everyone's cool, and I'll also stay in your penthouse suite in Vegas. So that's my petition to Zarina. If we could all sign it, that would be great. Okay, thanks. And then you guys, my clinic is located in Pennsylvania, and then I have a new one in Delaware that is opening in a matter of weeks. Yay. It's in the very cute Trolley Square area. It is so beautiful and pretty, and I'm not just saying that because I decorated and renovated it. It's really, really cute. And it should offer a very wide range of services. In addition to weight loss, we'll also be doing hormone replacement therapy, IV infusion and injection services, and more to come on this part, but we also will probably be offering some aesthetic services in the future as well. So hopefully we'll see you there in Delaware. And like I said, I highly recommend my buddy Zarina when it comes to getting services in California.
Thank you. And yeah, same with Katie. She's a great resource to have if you're in Pennsylvania or now Delaware. So watch out, Delaware providers. Just kidding.
Hey guys, so today we have Emily Abernethy. She is amazing. She's a nurse practitioner, originally started off as a OR nurse here in Pennsylvania, and then went to the very prestigious University of Pennsylvania, became a primary care nurse practitioner, now lives in Colorado, where she works as a nurse practitioner for Busy Bird Weight Loss. Welcome, Emily.
Thanks, guys. I'm excited to be here.
So tell us about your NP journey and what inspired you to do primary care.
Well, as Katie mentioned, I started as a surgery trauma OR nurse or registered nurse, and in that really lacked that connection with patients. I saw them for surgery when they were mostly asleep, didn't really get much follow-up with them, so definitely was excited to have more of a relationship with patients. And then the preventative care piece of primary care just really spoke to me.
In your practice, what factors have you seen contribute to people kind of becoming overweight or obese?
Oh gosh, mental health, genetics, socioeconomic status, work life.
So like when you've worked with people that want to lose weight, or like if they have obesity or overweight issues, like have you seen any particular challenges with working with these patients?
In primary care specifically, I have worked with a really big Medicare and Medicaid population. And so something that I see for patients who maybe don't have the means to afford weight loss medication, if you're working a blue collar job where you're working 6, oftentimes 7 days a week, it can be really hard to build in time for exercise and healthy food choices, especially if you're raising a family at home while also trying to make ends meet financially.
Do you feel like compliance is a big issue too?
Yeah, I mean, I think you guys both probably see this. We receive a story. Sometimes that story is very accurate. Other times we're not at home with patients. They might tell us that, no, I'm not much of a grazer or a snacker, but they really are.
Yeah.
Yes.
I mean, okay, like I guess paint the picture for us. Like Colorado, like what kind of population do you typically see there? Is it like mostly like Caucasian? Is it Hispanic? Like what's it like?
I think Colorado has this reputation that everyone is young and healthy, and that there's very little diversity, which really isn't true. There's a huge Hispanic population, and a lot of the genetics that we see as far as like cardiovascular disease, diabetes, we see that in the Hispanic population just as much as we see it in African Americans.
Because when when we went there, I'm like, oh man, everyone must be so fit and healthy, and they're all working out. Like, I mean,
I was gonna say, Emily, I didn't see one unhealthy.
I took you guys to Vail, Colorado. Okay, next time you come, I'll take you to Thornton, Colorado. We can fully ourselves.
Talk about there's a why. I'm like, girl, all I saw was young
Yeah.
and healthy. I felt out of shape.
There's a lie.
Yeah, are there more overweight, obese, like I guess issues there? Like to me it's hard to imagine.
Yeah, there definitely are. It just depends where you're going. I mean, go to Walmart or the mall, or honestly, Eastern Colorado, which is right on like the Kansas border. We definitely see a lot more obesity there. And as you know, with these weight loss businesses, it seems to be that the smaller towns are the ones that really can have the bigger populations of those who struggle with obesity.
Okay, interesting. Because admittedly, with you owning a weight loss practice there, I guess in my head, I pictured Emily as having clients that were just like slightly questionably overweight, but like super, super healthy coming in after like doing like a hot yoga class, as opposed to having people that were like very, very obese, very, very overweight. So I think it's good that you bring
Yeah,
that
I think
part
it's
up.
quite the opposite. We see both ends of the spectrum, and there's not much of a gray area in between. You have your people who are super motivated, mountain biking, camping, hiking, all of the outdoorsy things, and then those who don't have those interests, who probably grew up here, and that's not really, the outdoors are not as integrated in their lifestyle.
Interesting. That being said, since we were talking about weight loss, tell us what your experience has been like with prescribing these medications. And when we say medications, we're talking about, of course, the GLP-1s. So the Ozempics and the Wegovy's and Mounjaros and tirzepatide, but also the tirzepatides and semaglutides that are probably at your weight loss clinic?
I have been working with these medications since really the beginning, just for my diabetic patients. And so getting to really appreciate the weight loss in them first has been just amazing to see. And then being able to offer this medication for patients who have come in year after year, where each year we see a 15-pound weight gain, but there haven't really been great options with oral medication prior to these GLP-1s. Or before it was really accepted to use them so widely. I mean, the prescribing culture that we're seeing now with these, it feels like it's only been over the last year and a half or 2 years that it's really blown up.
Yep. And similarly, I think, one thing I wonder about primary care providers who have been prescribing this for a while is, how do you feel about all the kind of like Ozempic propaganda that's come out, right? Like every week it's something new. Every week it's like, oh my gosh, Ozempic can take away all of your vision. Oh my gosh, Ozempic can get you pregnant. Just all this stuff. Are you like, oh yeah, I've been doing that. It's been doing that. Or are you kind of like, this is crazy and probably not necessarily as big of a thing as people are making it? Like, what's your kind of vantage standpoint?
To me, it feels like it's when everyone came out and said estrogen causes cancer. And we have to focus on the epidemiology and how we interpret this data. So maybe your risk of developing some sort of eye disease, ocular disease increases, but is it increasing by 0.01%, a tenth of a percent? And so I think really the best thing we can do is informed consent, provide that education for our patients, but also risks and benefits. I mean, what is the risk of being obese, both on your heart and pretty much every other organ in your body?
Absolutely.
Have you found issues with insurance and prescribing meds? Because I often hear like, well, my doctor wrote it for me, but my insurance doesn't cover it, or oftentimes it's out of stock. How do you deal with those problems?
The clinic that I've worked at in primary care, there's been a lot of red tape because it's not necessarily FDA approved for weight loss. So that's really hard, is knowing that this medication is beneficial, but working for a clinic that doesn't really want you to prescribe it for anything except diabetes. And that was one of the big motivations in opening Busy Bird Weight Loss and being able to increase access to the medication. And then I have plenty of patients who their insurance does pay for it with a prior authorization normally. But then after you submit it to 5, 6, 7, 8 pharmacies and every single one is out of stock, they end up or elect to go to a weight loss pharmacy anyway for that increased access.
So true.
Yeah, I mean, Kate,
and honestly,
sorry to interrupt you. I remember you have this one pharmacy that in Philadelphia that you will not tell others where you can get it, but even their stock seems to be decreasing.
Yep, exactly. Absolutely. You are exactly right. So it's crazy, but like, honestly, most people seem to be struggling to get medications like Wegovy. And then when they do get them, it'll be like, oh, I got like 2 months worth, but now they're out of stock again. And then how do you lose weight successfully if your progress is constantly being like postponed by not being able to access the medication? It sucks.
Yeah, and it really does feel like for someone who struggles with side effects and needs to up titrate really slowly, that makes it even harder.
Yep. One question I had for you that I've been thinking about a lot in my own practice when I have clients come is I get a lot of patients that come and they're like, and I'm asking them like, when's the last time you saw your primary care provider? Have you talked to us about your primary care provider? Do you want these clients to talk to their primary? Like, do you want them, if it was your patient, do you want them to come and talk to you first? Or how do you feel about them just going directly to a weight loss provider first?
That's such a hard question, Katie. I think that it really depends on your rapport with your PCP. It's just like going to therapy or to any other healthcare provider. If you have a good open relationship with them and you really keep them in the loop with your healthcare in the way that primary care is intended to be, if it's utilized perfectly, then I think it's great. And let your PCP do the legwork with drawing the labs and interpreting the labs and being your cheerleader. But of course, not every PCP is like that. And so if you don't have that relationship already built up, or you feel like there might be some bias or judgment, which can happen, unfortunately, then I don't think it's inappropriate as long as you've found a safe source. If you can if you have the confidence in your weight loss clinic that they're getting good product from reputable sources, absolutely, I think it's okay to go there first.
Yeah, I find for some people, if they wanted to go to their primary care and they ask, they're like, I want to lose some weight, or, I heard about this medication here. And oftentimes it's discouraged. They're like, well, you could just diet and exercise. And like 9 times out of 10, pretty sure that's what they've been doing for the most part.
Oh, I didn't
Yeah,
think of that.
right. So I think, like you said, it kind of depends. Maybe like they're restricted by what they can do. Like, for example, we have Kaiser here in California. I think it's prominent in like some other states, but they really try hard not to like prescribe certain things, and it's just harder to do, harder to get.
I think that's such an interesting aside, I guess, like send a patient to a cardiologist and they will say, find a GLP-1, find a clinic that will get it for you. And then you send them to a PCP who is either less informed or has their own sort of bias. And they're like you said, diet and exercise. And so which conventional medicine providers are the ones that are our patients' biggest cheerleaders with their weight loss journey?
It's also interesting how certain primary care providers have certain feelings about sort of the compounding pharmacies. I get referrals from a lot of primary care providers right now, and they know that we offer compounded meds, and they're sending their patients because that prior auth didn't go through and they want their patients to do it. And then I have other patients who are like, oh my gosh, my primary care provider says that I shouldn't use any compounded medications, et cetera, et cetera, et cetera. So it's very interesting how sort of like large that spectrum is in terms of like wanting your patient to get weight loss care, but also being weary of some of the options out there as far as accessing the medication.
I mean, compounded pharmacies have been out longer than the three of us have been alive. So it just feels like lack of information, lack of experience. I'm not sure what it is, but it used to be that if we can prevent the additives by using compounding pharmacies, that was sometimes the safest way to provide medication to our patients. So that is shocking to me. I think, unfortunately, it's just because there's some international compounding pharmacies, or what they call like these research pharmacies that we're all familiar with, that give a bad reputation to some of the really great compounding pharmacies that have individuals who have their doctorate in pharmacy who are such a wealth of information and can be such a great resource for us.
So it seems like many patients, they have a goal of coming off of like their antihypertensives if they have high blood pressure, or if they have high cholesterol, they're like, I don't want to take the statin anymore. Or if they're diabetic, they want to so once they hit their goal weight, is it a realistic goal like to stop taking weight loss meds? Like, do you see it within certain age ranges?
Is it a realistic goal to stop taking the weight loss medication once they achieve their weight loss goal?
Mm-hmm.
It kind of depends on the big picture. I think if you have an individual who's starting out at 400 pounds, and that's just a random number, of course, that I'm throwing out there, but some of our heavier individuals who oftentimes have some sort of binge eating or eating disorder associated with their weight gain, I think those people would be best off probably staying on a subtherapeutic dose once they achieve their weight loss goal to maintain it. I think it is realistic to get off of these medications after a certain period of time for a lot of individuals. My personal feeling is that we're tapering down a little bit too quickly, and that the way that we can really succeed in helping maintain these weight loss goals is with a maintenance of a good 4 to 6 months on a low dose once your goal is achieved, and then helping with tapering down.
I guess related to that too, like with people that do have like high blood pressure, do you think it's realistic for them to get off of blood pressure meds?
Depends on the genetic component. If mom and dad have high blood pressure, it might not be realistic. We might be able to, instead of being on 3 antihypertensives, be on just 1 ACE or ARB. I think that's realistic. Or being on 2 medications, but at a much lower dose. But if there's a strong family component, I don't think we're going to completely get off of all of them. And then for cholesterol, are you losing weight with the help of GLP-1s, but also really making aggressive changes to your diet, or not? If you're just changing the amount of food you eat, but not the quality of food that you eat, you will lose weight, but your cholesterol might not improve as much as we would hope.
So I guess in your experience, have you also seen it too, where if they are on a GLP-1 and they have cholesterol issues or blood pressure issues or diabetes, like do GLP-1s help with those other issues too? And have you had to like lower the dosage on something else they were taking?
I definitely have lowered the dosage specifically with antihypertensives for blood pressure. That's the one that I probably adjust the most. And then, of course, for my diabetics, I oftentimes, with the help of a GLP-1, can get them off of insulin. It has to be a slow process. Normally, you decrease by 20% at a time. And then sometimes can even get them off of like a pioglitazone or another oral anti-diabetic medication. And just stick with like a metformin and a GLP-1. And it does take time, but to me, that's a success, being able to just be on an injectable and an oral medication to control diabetes.
Yeah.
And actually, that was one of my questions, Emily. If I'm diabetic and I'm on something like metformin, can I do something like a GLP-1? Like, can I do semaglutide, or is there a concern that my glucose level would be too low while on both
Yeah,
drugs?
neither of those meds cause hypoglycemia. The best thing about GLP-1s is that really it targets the sugar after you eat it, unlike insulin or pioglitazone or glipizide, where it can always have that risk of causing hypoglycemia, particularly if you're not good at eating every 3 to 4 hours. We don't see that with GLP-1s. I have seen some patients complain of like decreased energy, but oftentimes once you bump up protein and really focus on macronutrients as well, that seems to resolve.
And we're about to ask you some questions about your weight loss practice, but I did want to just ask you a question on behalf of all of my patients. Actually, in particular, all of my millennial patients who have no clue how often they're supposed to be seeing a primary care provider. So they're like, I don't know, how often am I supposed to see them? I haven't seen them in like 4 years. Do I have to see them every year? Do I see them every 2 years? Or do I see them every 3 years? So please, let's hear it from the horse's mouth. Not that you're a horse. Tell us, how often should people be going to see their PCPs?
Historically, a PCP's intention is preventative health. So the best rule of thumb, once a year. Come to us before you have a problem. Get your baseline labs year after year. That's oftentimes how we catch things like cancer or diabetes before your A1C is 13% or before your white blood cell count has tanked. If we are tracking and trending your lab values, that's how we really practice good preventative health. When you come to me as a 55-year-old adult who hasn't seen someone for 15 years with a laundry list, it can be overwhelming for the clinician and also for the patient.
Yeah, I remember when I was doing my clinicals and then they'd be like, "Oh, I've had this abdominal pain for like 5 years." And I'm like, what do you want us to do about that?
Yeah, I mean, do you ladies remember in nursing school when we were taught you will never again be able to just walk down the street and not really see someone? And now it's like I was at the hot springs this past weekend and I'm like, I wonder if they know they have a hernia, or like you just start seeing patients, or not even patients, you start seeing regular people as patients.
Yeah, for sure.
You 1,000,000% do. Mark, my husband and I were recently talking about Game of Thrones. We were watching whatever that dragon show is now, the spinoff show. And Mark was like, I wonder if he's ever going to finish the other books. And I was like, I don't know, man. That last interview he did, I don't know. He might have CHF or something. He was awfully short of breath. He was like, what is CH? I'm like, don't even worry about it. I shouldn't have said anything. Maybe it's COPD, but my man was looking real short of breath in the interview. And then I was like, oh my gosh, Katie, you have to turn that clinician brain off.
Nope, I don't think you can. It's hard.
Yeah,
I can't.
it's ingrained now.
Can't. Side note, y'all watch one of his interviews. You're going to agree with me and be like, that book was
Yeah.
Oh my gosh. Emily, I wanted to ask you as well, like in your experience, I mean, with as far as brand name, have you seen a difference as far as like what's better in your opinion? Like, do you feel like Ozempic is better? Is Mounjaro better?
I think undoubtedly tirzepatide is great. It's better. There's a big financial component to it. What's nice is in insurance, there's not as much. If your medication is covered by insurance, like Zepbound and Mounjaro seem to both be covered just as easily. It just depends on what's on formulary for your insurance company. But the side effect profile is better. The weight loss is more significant. That being said, if you lose weight and you tolerate semaglutide, excellent. Stick with it. There's no reason to switch. And I think that we just, as clinicians, all three of us, we hear about the side effects and the negative more than the positive, and that just makes that brings that emphasizes the side effects maybe more than they otherwise would be.
Mm-hmm. And have you seen more weight loss with one medication over the other, like Ozempic versus Mounjaro? Or
Yeah, I think I see probably quicker weight loss with the Mounjaro, tirzepatide, Zepbound.
mm-hmm.
But I want to bring that back to saying those who are really motivated from the get-go to start GLP-1 or GIP GLP-1 with exercise and with dietary changes, they all lose weight just as quickly. I think when you're sedentary and not making those changes, that's when the tirzepatide to me really sticks out as being quicker or more marked with its weight loss.
Yeah, I agree.
Interesting. I agree. That's what I've seen as well. Yeah.
Mm-hmm. I feel like with tirzepatide, yeah, not as many side effects, and people like tend to lose more weight consistently on average, like probably like the 5 or 10 pounds that we like to see. And then with semaglutide, oftentimes I have my patients reaching a plateau and they're like, can I have something stronger? So then I'll be like, yeah, I think you should try tirzepatide at that point. And
I've had a similar experience. It's just, I find it easier to have that conversation before you even start so that if and when that happens, it doesn't feel like a failure and you don't get sticker shock as much with the cost increase. I kind of learned that the hard way. I was a little bit embarrassed in the beginning about talking about tirzepatide unless individuals specifically brought it up. I just felt uncomfortable with how much more expensive it is. But I think now that that it speaks for itself, it's worth just mentioning both up front.
I actually had the same feeling. Originally, I kind of like almost resented the drug because it was so expensive. And I'm like, yeah, there's this other drug, but don't worry, semaglutide works just fine. People are losing weight on it. That's how I felt. But then the results that you get from tirzepatide have been so incredibly impressive that it's like you can't even deny it anymore. And the truth of the matter is, although these drugs, all of them are expensive, when you look at just how incredibly expensive it would be to pay for Zepbound or Mounjaro out of pocket, for most of the prices that we're charging from these compounded pharmacies, it's still like a steal. Not necessarily affordable for everybody, but overall, much more affordable than it would be if you were trying to pay for it out of pocket. And more affordable than a hospital stay, a stroke or a heart attack from hi, Birdie. Don't worry, our listeners are used to it. All kinds of stuff happens on the podcast. Doggies, kids.
Welcome to real life.
No worries. Yes.
Yeah, I find I will push tirzepatide more if they are known to have nausea, and if they don't want to deal with nausea. Because with semaglutide, I have some patients that don't feel anything at all. But most of the time, yeah, they do complain of some nausea after their injection. And so I just kind of put that out in the front because I don't want them to deal with like having too much nausea and all the vomiting. And then after a month, they're like, you know what, this is not for me. Because why go through that? Why put yourself through torture? So I put that out in the beginning too. Just like, well, if you want to have something with like barely little to no side effects, tirzepatide's one for you. And I find that there's more consistent weight loss with the tirzepatide. So if you feel like you've tried everything and you just want the best of the best, like the tirzepatide's the one.
What about the skin side effects? This is something that I feel like no one really talks about, but have you started to see more and more with semaglutide some of those weird complaints about like skin sensitivity?
I did actually, yes.
That seems to be early on. Okay.
Yeah, and I thought it was just this patient. I'm like, I don't know. No one else is complaining about it besides nausea. But it was just one client out of like my, I don't know how many hundreds I've seen at this point. But
right. Yeah, I agree. In the beginning, I was really worried that someone had shingles. It was like what you're describing can be the prodrome of shingles, just like the numbness and tingling, which sometimes happens before the rash shows up or before the skin irritation.
Yep.
But I've actually seen it more and more lately, and it goes away when I switch those clients to tirzepatide. And then recently someone described it to me. They were like, it feels like when you're a kid and you have a really high fever and your skin is just sensitive to touch. He said it's not painful, it's not unbearable, but it feels just like this kind of internal skin irritation.
Is that something that they complain about
Go ahead.
right after the injection, or is that like the whole time throughout the week?
I don't know the answer to that. It's a good question. I imagine it would be probably like a good 5 days, but I don't actually know.
Yeah, I have some people complaining of like headaches and fatigue. Um, so at that time, I just, suggest like, well, try drinking more water, of course. And like with the semaglutide, you just don't really have as much food noise. And so some people don't think about eating at all. And so
Right.
it'll be like 3 p.m. and they're like, oh, I haven't eaten anything. And then, of course, you get that kind of like headache because you haven't had any food.
Yeah, and it's hard to attribute that to the lack of eating when you don't feel hunger.
Yeah.
Yep.
Yeah.
That's why I always remind these patients to like hydrate and drink water, because that's one of the things that they totally are going to forget to do because they just don't feel like
The
it.
one thing that I think that's important, especially with all of these heat advisories across the country for our patients who are drinking so much water, because I just had one who came to me, yep, I'm drinking 120 ounces of water, but I'm still feeling thirsty. I'm feeling a little dizzy. I think that you can overhydrate in this heat, and the importance of adding electrolytes into your water. If you're going to drink that much water, you have to replenish your electrolytes or you're diluting all of that within your body.
Yeah.
That's actually a really good point.
That's so true.
1,000,000%. And it's been hot here, and I'm sure it has been in
Yes.
Colorado. And I feel like Cali's always warm. So yeah.
They don't have that humidity though.
True.
But no, I totally agree, you guys. I think tirzepatide is a great drug. The main thing I've been emphasizing to patients when they come in is I think that with semaglutide, it's much more of an exercise in patience, right? We're going to put you on that low dose for 4 weeks. And then you might land at like 30 units, but you might also land at 100 units. So you could be at your target dose at week 6. It could also be week 10. I don't know. Whereas I think in most cases with tirzepatide, you're going to do that 4 weeks for that low dose for 4 weeks. And then most people are going to land at that 5 milligram dose. And that's kind of their dose. So in that sense, the medication sometimes works quicker. And for those who really are like, have a strong emphasis on like, I want results right now, or I'm going to lose motivation, I think that's something important to keep in mind, because I can't promise you that you're necessarily even going to be at your target dose with a semaglutide, even within a couple of months. Hopefully you will, but I can't promise.
Yeah, because oftentimes how we increase it is like monthly, right? Or after 4 weeks. So to get to the 2.4 milligram dose, it's going to take you, I don't know, a few months versus the tirzepatide. Like I usually start off at 2.5 for the first month or so, and then 5 milligrams after that.
What's interesting for me with the 2.5 is I pretty much always go up to the 5. But it seems like the appetite suppression stays strong on the 2.5, but the complaint I get is that it doesn't last. So I have some patients who are a little bit hesitant about making that jump from the 2.5 to the 5 because they're having that appetite suppression. They're just not having the 7 days of appetite suppression.
Yeah, I've had some clients tell me like, is it a loading dose? And I'm like, no, it's not like semaglutide. Like the 0.25 is definitely a loading dose.
Oh, for sure.
Yeah. Like you could stay on 2.5 if you want. And,
Sometimes I have that happen with semaglutide patients, though. I actually had 2 this week who were like, yeah, like I felt like I was less hungry on the 10 units than I was, which is the 0.25 milligrams, than I was when I'm on this 0.5 milligram dose, this 20 unit dose. And I'm like, IDK, I don't know. This is my first week here seeing this happen, but maybe there's sort of this like initial like adjustment that your body makes during those first few weeks to the drug. And then when that part kind of wears off, you kind of just, again, aren't.
I think that's more of what it is just a lot of patients think it's because of the dose, but really it's just in the beginning, the body is so shocked from the new medication.
Yep, exactly.
But I've had similar reactions like, I don't know, I'm really puzzled by that. And then the more I see it or think about it, I think I agree with you, Katie.
Okay, good. Glad to know I'm not crazy, but this is like what I'm starting to see and what my hypothesis is.
It's a good hypothesis.
I love having you on this podcast right now, Emily, because I feel like all these other like primary care questions that I've had, I can just ask.
Well, it also feels like we're just hanging out, and I love hanging out with you too. So
I know. It's like we're reliving our Colorado trip.
We're reliving our Colorado trip, and we just did a podcast where we were talking about how fun our Colorado trip was, and we did another podcast recording recently right before this where we were talking about how they should go to Busy Bird Weight Loss if they want some exercise training, because I said Emily gets down.
Boot camp.
We were all talking about I said, Emily says I looked at the floor and I said, Emily, you like do the workout? You do demos? And you were like, yeah, I do demos.
I get on the ground and show some workouts every once in a while.
Yeah, which is like so impressive. But after a long weekend with you in Colorado, I totally believe it. Mm-hmm. I probably came home healthier than I did when I left. I knew it was going to be real when Emily sent that text talking about you guys want to go to Orange Theory at 7 in the morning after you fly in at 10 p.m. the night before.
I mean, I felt like that was a really reasonable ask. I chose to invite you to the 7 a.m. instead of the 5:15 a.m.
It was an earlier class. Oh my God.
Later, I learned that Serena likes her sleep.
Serena we didn't see Serena until like late. We had gone on like a whole walk. Did all kinds of things, and then Zarina came down, but
which is not my usual.
To her credit, your flight was delayed.
Like I didn't go to sleep until like, I don't know, 3 a.m. And so I was like,
yeah.
Anyway, since we're talking about Busy Bird, could you tell us more about your practice and what you do?
Busy Bird is a weight loss clinic. It's primarily telehealth, but I do have a brick and mortar location in downtown Denver. The primary motivation for starting it was being able to serve primary care patients who weren't able to get this medication through me as their PCP. I struggled with how to communicate to patients that I had this clinic because I never wanted it to be this, I never wanted to overstep any boundaries or have any conflict of interest. And so what I would do is encourage my patients to just search for weight loss clinics that were convenient for them and just...
With the word bird in it.
Look for a weight loss clinic that maybe has the word bird in it. No, but just encourage them that, there are a lot of satellite weight loss clinics that can provide this medication, even if you can't get it from your primary care clinic. And the best thing you can do is shop around for both reputable clinics that have good reviews, that use accredited pharmacies. And from there, I mean, I think you probably both agree. I just love it. I love the feedback that I get. It's such a fun, it doesn't feel like work. And that's been really great.
Yeah. And I'm sure that's very,
it's so fun.
It's nice that you can kind of be that solution for people. Like, as you were mentioning, how it's hard to get the GLP-1s through their insurance. And then you could just be like, well, you know what, if you want to do the compounded, I can offer that. So it's nice to have a solution for that.
Yeah, definitely. And you always, the best thing you can do as a PCP or a cardiologist, or when you're recommending this medication, is just encourage patients or remind patients that they have a choice where they take their care, and encourage them to shop around, do their due diligence, and really just make sure that they're getting the service that they need. A lot of these telehealth only or really cheaper options that we're seeing both on social media, on Facebook, or just on commercials, there's not as much hand-holding. And I think that we owe that education piece to our patients, especially when this medication it's different than most medications they've taken. It's not just a pill once a day with very few side effects.
Yeah, and there's like dose titrations that have happened and side effects that can occur. So it's nice to have a provider that you can call and let them know about this. And just kind of, again, like you said, having that guidance, like follow-ups are really important too.
Definitely.
And just letting the patient know this is what to expect. You're not going to lose like 20 pounds in a month, but you're making progress.
So. Right. We're so lucky that the three of us get to have each other as resources. I think that we all have such good input and different experiences and think of things a little bit differently. And like, that is why Busy Bird and the A-List Clinic and LifeFire are succeeding.
I totally agree. Our group chat is pretty good. So it's so cool. It's so cool to have you here, because fun fact, you guys, we were supposed to do this like in person in Colorado, but we were having way too much fun. The weather was way too beautiful to like sit down and like do work. So we were like, you know what? Mental health first, our mental wellness first. We're going to have fun and enjoy each other. And then we'll do this virtually, which is totally the right decision. But it's so cool to finally have this happening.
Yeah, I'm so glad you initiated this and got over my little fear of the camera and the microphone.
I know. I was like, is she ever going to come on? I don't know. Like, because we initially even wanted you to be a co-host and you're like, no.
Oh, yes. This is what I meant to say. Emily would have been And the third co-host, and when I first started this, Mark was like, how come it's just you and Zarina? How come Emily's not in it? I'm like, I asked Emily. Emily says she doesn't like the sound of her voice and she doesn't want to do a podcast at all because she doesn't want to like have to talk and hear herself. Like, but yes, we were going to have Emily. We love Emily so much. We were going to have Emily as our third. This was going to be a 3-host, a triple threat weigh-in podcast. She was going to be the third weigh-in NP, but Emily said, absolutely not.
She's like, I got hiking to do and camping, so no.
Yeah.
Hey, I mean, now knowing how much work this endeavor has taken,
You're not wrong. You're not wrong. It was just funny because she immediately said no. I thought there was going to be
Back to you.
If there was y'all, yes, y'all. I didn't even see like a ... I was like, "Do you want to do this podcast with me?" And it was like, "No."
Oh, love the honesty. You know, it just makes things clear.
That's
Love
the
the
best
boundaries.
thing. That is the best thing about. That is the best thing about Emily. Is Emily keeps it 100
for better or for
all
worse.
times. For better or for worse, I love being able to talk to you because you are so honest. We make a good triad, and you're always welcome to come on to our podcast and be a host if you ever desire. The position of having you as the co-host. Is it still a co-host if it's 3 people?
Yeah, I mean, I've seen podcasts.
What do you call
where
it when it's
3.
like?
I don't know.
It's not a bi-host.
Like, do you use the word co-host? A tri-host?
No, I think it's still co-host. Like
I think
Emily was saying.
yeah.
It's not like bi-host or tri-host or whatever.
Well, you're always welcome to come and be our third co-host if you so desire.
Thank you.
But I already know you're like, thank you, but no. I'm
I
good.
got my Orange Theory
I'm good,
class
not
at like
interested.
5 a.m., so no.
Yeah, 5 a.m. It does not fit with my schedule. And speaking of high energy, can we please talk about NAD? I know that you offer it in your clinic. You're the one who got me all excited about it. Tell us why you offer it, what type of clients you're giving it to, and what your clients think about it.
NAD, it just seems to be that missing piece for so many people who they're on this healthcare kick. They're already focused on losing weight, but now they're thinking about what else can they do to optimize health, get those anti-aging, anti-inflammatory benefits. What I really like about NAD, with a lot of other peptides, you're dosing 3 to 5 days a week, and that's an investment. I like the half-life of NAD, and I like that you can give it once a week. You can give it every 10 days. You can even there's some research that you can do like kind of like this loading dose where you do it once weekly for 6 weeks and then you decrease the frequency. But some of the feedback that I've gotten is just recovery quicker after a workout, that mood boost, energy boost, and then decreased joint pain. So feels like all good things. Katie, I think you can speak a little bit about that boost that you get right after the injection.
You already know I'm obsessed with it, and it's your fault. I'm obsessed with it. She mentioned it super casually, and I was like, tell me more. And then I tried it, and I'm obsessed with it. I feel amazing. I think it's like better than any pill that one could ever take, because the level of energy, what it does, I feel like it really reduces like brain fog. If you've ever like had a really long day that's really mentally exhausting, or worked a really long 9 to 5 or 12-hour shift, and you come back and you're just like tired the next day, like on a Saturday morning, I feel like when you take the NAD, you just get so much mental clarity. And that's what I love about it, is I feel like it really reduces the brain fog.
I'm glad you mentioned that. That's such an important piece to really focus on, especially for these long COVID patients. Maybe we're seeing them for weight loss, but they have some of these other conditions that they're dealing with, and they can really benefit from NAD.
Yeah, when Katie was talking about it,
People
she's
love
like,
it.
I feel like Superwoman. I'm getting all these tasks done, and normally I'm very like
I was
distracted.
wildly productive.
Wildly productive in the group chat.
Extremely. I was like, what's up, y'all? No one's answering me. Everyone was taking all long to answer, doing real work. I'm having such a great day. I feel really great. How are you guys? But no, I feel great. And you guys, my mom is hooked. She's the one who also made me think about it, because she and her, I shouldn't call them little friends, but like her friends that are in her general area. She lives in Maryland. A lot of them have been doing it, and she wanted it, but she doesn't trust other clinics. And so she was like, well, I've heard about this thing they're calling the Benjamin Button. I read about it online. She was like, how do I get this? She was like, can you get it? I'm like, I'm sure there's clinics in Maryland that offer it. She's like, but I don't trust them. I want you to offer it. So I was like, well, don't force my hand. So now I've got to like offer, and now I've got to offer it and keep it in stock all the time. So she loves it. She drives up from Maryland to get it from me. And then she's able to like self-administer it at home. But yes, NAD is amazing.
Yeah.
Highly recommend.
Yeah, because if you break it down to like what the cellular level, it's supposed to help with like anti-aging and like making new cells and whatnot. I don't really know exact science, but
no, I think you're right on it. It's a naturally occurring amino acid. It's part of the building blocks of our protein. I think I'm saying that correctly. And so anytime you give an exogenous hormone, peptide, protein, amino acid of something that we already have at baseline, especially something that decreases as we age, it seems to just like give you that added benefit.
Yeah, I've taken it once too when I was in Colorado because they were like, oh, what? Just try it. I'm like, okay, I guess so. So I did that. And just as a warning, like it does feel strange after you give yourself an injection. Does it get like any better after that? Or do you always have that weird kind of like, I don't know.
With each injection, do you mean?
With the NAD, like does that sensation get any better afterwards?
I don't think so. I really always feel it for a good like 7 to 10 minutes after the injection. And to me, it's like taking a shot of liquor. It's like you get warm, a little bit nauseated, and then you just feel this boost of like energy, mental clarity, as Katie said, and the rest of the day and even the next day, even though it lasts for more than just one day, I feel like that really obvious feeling of energy seems like that the first 24 hours.
How often do you have most of your clients taking it, Emily?
I seem to do once a week for the first 6 weeks. And then from there, I really leave it up to the client. I try to be really mindful of the financial investment. And so
it ain't cheap.
It's expensive. And so if you can afford it and you really love the benefits, great. Come in week after week. Otherwise, I'm totally open to decreasing the frequency or increasing the interval between injections as long as you still feel like you're getting that benefit.
Awesome.
Very cool. Emily lives a very super healthy and active lifestyle. On a personal level, do you have any tips for staying consistent when it comes to maintaining that healthy and balanced lifestyle?
One of my favorite things to do, I'm very social. I love spending time with my girlfriends, is incorporating something like some sort of activity or fitness into spending time with friends. So trying to not make all of my socialization be around a meal or alcohol. Let's do a workout close, then maybe go out for a coffee. Let's go for a walk or a hike. And then it's just a fun way, and you both leave feeling better, and you've had that girl time.
Yeah, I was just thinking about back on our trip. I really liked how we like spent so much time outside, like in the morning we're like, oh, I'm gonna walk Birdie, and then like turned into like, oh, let's go get breakfast over here, and then like even in Vail, incorporated a hike, and that was really fun, and it kind of refocused things how I spend time with people as well. Like you said, it doesn't always have to be over dinner or drinks. I think you guys can all do something together. But of course, kind of just depends on the other people too, if they're down for that as well.
Definitely. And then my favorite thing about that is oftentimes it takes you away from your phone. If you're in the middle of a yoga class or on a walk, your phone is away. It just feels like more undivided attention and quality time.
I feel like we got so much nice quality time in. Oh my gosh, I can remember just waking up and like going to get coffee and just like laying out in the sun, Emily. It was so nice. Surreal and relaxing.
You know what I remember is the photo shoot that we took of you while on the hike.
That was a struggle because I think that was like during one of your breaks, right? Breaks. And, like we're just trying to get air.
Y'all,
give me the inhaler and I'll take a photo.
I thought I was ready. Yep. That hike was something else, because I thought I was ready for it, and in many ways I was, but what I wasn't ready for was that high altitude.
It makes a big difference,
and so it really like made it hard. So I started coming up with all kinds of reasons to stop, and you already know we needed some socials, so I needed some pictures done. Emily was like. Like I was crazy. I was like, hold on.
That's true. I was a very patient and accepting friend.
Oh my gosh. You totally were. Also, things I wasn't ready for during the Colorado hike. That splash of snow that we got up top. I wasn't ready for that. Ready for that? Oh my gosh. And hold up, Zarina, do you remember when Emily skipped across that river? She...
Did we all end up doing it or no? No, I think you were just checking it out. You're like, let me see if there's just any more snow here.
No. The first river we all three went across, but we had to like basically throw Katie a leash and like carry her across.
You did. That was crazy. You guys, there was a straight up river with like two little rocks, right? Mind you, there's snow everywhere, which I wasn't prepared for because it was springtime. I didn't know Colorado was doing all that. We go there with the river. Now, so first Emily goes and she just prances across like two skips and she's just on the other side looking at us like, hurry up. And then Zarina goes, and even Zarina makes it across, which is already crazy because Zarina couldn't even breathe. Zarina had like the plague. She had like, I don't know what kind of pneumonia you have, but Zarina was like coughing. She had like this ongoing chronic cough. Yep. But Zarina made it across. And then it was my turn. And my thing was like, first of all, I already can't breathe up here. Second of all, this looks like death. There's no way for me to cross this. So you guys, I had to walk. I got my feet wet. My socks were wet. It was crazy. It was a struggle. I did bring backup socks though, but that's
crazy. Just the mom in you. That was crazy. You know about these things.
It is. I was like, y'all are not going to get me. I think I crossed on all fours very carefully. I was like, you guys are not going to get me. Because I knew that I was going to bust my butt if I tried to do what Emily did. Part of having a healthy workout routine and being safe in general is always knowing your own limitations. I am not a prance across the rocks type of chick. You know what I mean? I'm going to carefully make my way across and I'm going to finish the hike safely and in one piece. That's the type of person I am.
Because the last thing we want to do is carry you back and like, oh, you have an injury.
Yeah, y'all were definitely going to be
We would have had to sled her back. I don't know.
Oh my God, you totally would have. And you guys should have heard the drama that I gave when Mark was like, oh, how was it? I was like, oh my God, I almost died, let me tell you. And I told him all about how I had to go over the hill, through the woods. I was on these little rocks, crossed a river. But oh my gosh, it was so fun. And I felt so accomplished when we like made it kind of to the top, but not really, but close enough. We made it close enough to the top.
Yeah.
And it was, and the views were totally worth it. And the bonding time was totally worth it. And it was just like beautiful. It was beautiful.
Yeah.
Beautiful. And for those of you that are struggling with being overweight or obese, I also just want to say, as somebody who has struggled with my weight, it's so fulfilling to be able to like do stuff like that, all jokes aside, to be able to be physically active enough that you can enjoy things with your friends, that you can enjoy the beauty of the outdoors, right? There have been times 70 pounds ago where I never would have even been able to take 3 steps on that hike. I would have been like, y'all go, come back, let me know how it looks, take some pictures, I'm going to sit here. So it's nice to be able to like actually do engage those things. And it's one of the many benefits of sort of making life changes is that you get to enjoy new parts of your life, like going on hikes with friends. So
yeah, that's awesome and good for you. And that's amazing, amazing work.
I will never be a rock star.
No, I don't encourage it, especially again, if you fall on your ass and injure yourself. We have to take care of it.
On our next annual Colorado trip, we'll see what happens.
See, you never know. You know what? I'm a train for the next
one. You're going to start on your like, what do they call that? The box jumps and stuff?
I was going to say like, maybe you can find a Ninja Warrior gym and that will prepare you.
Girl, I'm going to need some type of Ninja Warrior type of training to do these hikes with you, to be Emily ready. And we definitely need to do annual Colorado trips because they're so fun.
Mm-hmm. Definitely. Do you have anything that you'd like to plug? Like, where could we find you as far as Busy Bird weight loss and all that?
Just Google me. Google Busy Bird weight loss if you're interested in weight loss in Colorado. But I really just want to thank both of you. This has been way more fun, and I'm glad that I didn't come up with a good enough excuse to bail this morning.
Yay! We're super fun.
Yes.
Yay! It's been a pleasure. Hold up. You guys know I love pictures. We're going to take a picture real quick of the screen. Say cheese. So cute. I'll send it to you in the group chat. It's been a pleasure, Em. We'll talk to you soon.
Have a great weekend. Bye, ladies.
Bye.
See ya. Bye. See ya.
If you've enjoyed today's episode, please take a moment to subscribe to our podcast, give us a rating, and share with your family and friends who might find it helpful.
And remember, we love hearing from our listeners. Connect with us on our social media channels or shoot us an email with your thoughts, questions, or suggestions for future topics. Don't forget to check out our website, www.thewayinNPs.com, and to follow us on Instagram at thewayinNPs.
If you need one-on-one help with your weight loss or wellness journey, book a private consultation with us. The A-List Clinic can be reached at www.thealistclinic.com or on Instagram and TikTok at The A-List Clinic.
And my clinic, Lifefire Weight and Wellness, can be reached at www.lifefireweight.com or on Instagram and TikTok at LifeFireWeight.
Thanks again for tuning into the Wayne Podcast with your hosts, Katie and Zarina. Until next time, take care and be well.
The information in this podcast is for general information only. It is not intended as medical advice and should not be relied upon as a substitute for medical consultation with a qualified medical provider familiar with your medical needs.